We do that, Senator Leyonhjelm, do you want to try your question? I suspect it's going to have to be taken on notice.
It may come under 4.3, but I'm not sure. So to begin with, would it be fair to say that medical abortions, by which I mean RU486, which is on the PBS, imposes a lower cost on taxpayers than surgical abortions, which are covered by Medicare? Would that be accurate?
Senator, I have to have a closer look at that. I don't have that answer to hand as to what the relative cost effectiveness of that is, but Ms Shakespeare, who looks after our pharmaceuticals arrangements, might be able to shed some further light on that.
So mifepristone, which is listed on the PBS, has been assessed through normal processes around PBS listings to ensure that it is cost effective. I don't think you can directly compare the two as interventions. Mifepristone can really only be used in very early stages of pregnancy, I think up to about 50 days, whereas the surgical procedures can be used at different stages of pregnancy.
Are you able to perhaps take on notice, within the limitations of the data and what you've just said, a relative cost assessment of the two?
I think we could certainly provide the costs.
So again, could you just speak up a little bit?
We could certainly provide the costs, so the PBS listing price for mifepristone and the MBS items that would be relevant.
Yep. All right. Yes, if you would take that on notice, please. So on a like-for-like basis, so same stage of pregnancy, same stage of termination, would it be true to say that the medical approach costs less or more than the surgical approach?
I don't have that data here with me on the costs. Okay. We'll need to take that on notice.
Yes,
Senator.
if you could take that one on notice too. Are you able to tell me how many GPs prescribe? Now, I don't know the brand name of the RU486, so you were using it, but I didn't catch it, so I'll just use that term for now. Do you know how many GPs prescribe it?
What we would have is script numbers, which we could provide. Again, I'd have to take that on notice. I don't have the script numbers here with me.
No, script numbers.
I'm not sure whether or not we could identify how many particular prescribers had written those scripts. I'd need to check on what data we do collect.
Are there limits on GPs being permitted to prescribe it?
I think within the context of the circumstances in which it's appropriate to prescribe.
Senator, I think there's a training package for people to prescribe these drugs, so they're generally people who have been through a course to prescribe it.
They do need to do a course. In order, a GP can't just prescribe it.
I believe so, but I have to check that out.
Okay, no, fine. I'm happy to take this information on notice. What I'm looking for is any constraints that the government imposes on the use of this as an alternative to surgical abortions. If this is a constraint that they need to do this training, or whether it's a choice on the part of the doctors as to which approach they think is more appropriate.
Yeah, and Senator, I think that's an important point you just make there. I mean, at the end of the day, these are clinical decisions for the treating medical practitioner. The government does not get involved in the clinical decision making of a doctor in consultation that the doctor has with their patient. Our role in both the availability of MBS items and indeed PBS is to make sure that there's evidence that underpins the item and that there are guidelines in place where those guidelines are needed. But at the end of the day, this is a clinical decision between the patient and the doctor.
Yeah, I respect that, and I don't disagree that that's how it should be. My impression was that there was a fairly significant limitation on the number of GPs who were permitted to prescribe the medical approach. and that was therefore limiting the options available to women who don't go to those particular GPs. So that's where I'm heading with this line of questioning.
Senator, I think if the GP wants to prescribe it, is willing to prescribe it and to go through the training package, it's not too difficult to get authorised, but they have to go through the training package because you wouldn't want any... There are complications can come from prescribing this drug. You've got to use it in the right circumstances. So I think it's up the willingness of the GP to want to take on that and to get authorised.
All right. So my final question on that is, and again, presumably you'll need to take this on notice, is can you provide me with the count of GPs who've gone through that course and are therefore permitted to prescribe this medical approach?
We'd have to take that on notice.
Yes, of course. That's fine. Thank you very much. Thank you, Chair.
Okay, we're going to go to